Hello everyone, I am Dr. Rwituja Thomas Grover, a consultant ophthalmologist and oculoplastic surgeon at Vision Eye Centers in New Delhi. And today we're going to be talking about a very important topic, that is glaucoma. I'll be coming to what glaucoma is, but January is known as the Glaucoma Awareness Month, and in March we have the Glaucoma Awareness Week. So it's important that around this time, when everyone is raising awareness about glaucoma, we also do our bit to sort of explain what glaucoma is. So now, glaucoma is basically what in Hindi we call kala motya, or it is a condition in which there is raised eye pressure. Now, eye pressure doesn't have anything to do with the blood pressure as such, that is the pressure of the body for which you take medicines. That is hypertension. It has nothing to do with that. It's mainly the water inside the eye. When the pressure of that gets raised, that is called glaucoma. And what essentially happens when the pressure gets raised is that it puts pressure, the water puts pressure on the optic nerve. That's the nerve from which we see. The vision is from that nerve. So as the pressure keeps increasing over a long duration of time, the pressure which affects the nerve, it tends to erode the nerve, and that's what results in glaucomatous changes in the optic nerve. Why is it considered serious? It's considered to be sort of alarming eye disease. Number one, because you can't detect it yourself, so it's not something for which people generally go into the clinic and say that I'm not able to, or I have this problem, so please get me checked. It's a silent disease because it first affects the peripheral vision. So, based on the areas of the optic nerve which get damaged by the high pressure, the peripheral vision gets affected first. So, not the central vision. So, when the peripheral vision gets affected first, you don't really realize that you're losing vision or you're developing dark spots in certain areas. So, that is one reason why it is considered serious. Now, the second reason is that it can cause blindness over a long period of time. So, as the peripheral vision keeps reducing further and further, what you're left with is a tunnel vision. So, you'll only have this much of vision, and if not treated or not appropriately detected on time, that can also go away. So, you'll just be left with little vision in the center, or the vision can completely go away if that part is not treated. So there are two main types of glaucoma. So one is the open angle glaucoma and the other is the angle closure glaucoma. So open angle glaucoma mainly means that the water pressure in the eye is high, and that sort of keeps affecting the nerve. Angle closure glaucoma is there is a part of the eye from where the water of the eye drains. So when that angle sort of becomes narrow of the part where the water drains, that is called angle closure glaucoma. And angle closure glaucoma can present all of a sudden with raised eye pressures, which are very, very high, and the person can have a lot of redness, photophobia, that is difficulty in looking at light, a lot of pain, and this can be detected in the clinic when the patient arrives. And the pressure has to be reduced fairly quickly in order to treat this condition. And in the other eye as well, once this pressure is reduced and laser or whatever is done, the other eye also requires treatment to prevent angle closure attacks. So these are the two basic types of glaucoma. Now, the main goal of glaucoma management is, number one, to detect that you have glaucoma and to treat it. So detection is mainly done when either somebody comes to us saying that they have some visual difficulty, or for a routine examination we do an eye checkup and we see that their nerve is suspicious. So when we see that the nerve is suspicious, we do certain glaucoma screening tests, like the field tests, the corneal thickness, the OCT RNFL, which is a scan of the nerve, and so on. And then with this, we can sort of come to a conclusion as to whether the patient has glaucoma or not. And further treatments are based on what we find in these tests. For angle closure, we do a lens-based test called gonioscopy, wherein we check if there's any blockage of the angle. And gonioscopy helps us to determine whether the patient needs a laser or not. So that is for angle closure glaucoma. Now, you can also detect it when, suppose somebody's father has glaucoma and we are screening the children. So usually around 40s or so, we would screen the children for glaucoma. And even with that, we can pick up glaucoma early. So in somebody who already has glaucoma, it's important that you tell your family members to go and get a screening done. Glaucoma is not something that only affects adults or older people. It can also affect people uh, who are in their teens, or the second decade of life. It's juvenile glaucoma, and it can affect children by birth also. So that's congenital glaucoma. And of course, as and when these are picked up, they are treated by the ophthalmologist or by the glaucoma surgeon. And either it can be medication or surgery. So, with respect to medication, there are various categories of medications that are used in glaucoma, and each category is sort of tailored to what issue you have. So, suppose you have some cardiac issue, we would stay away from certain drops and start with certain other drops. So, these are various categories, and once we start one or two drops, if the pressure is controlled, then well and good. Otherwise, we need to add uh, maybe another drug and another drug. So maximum we have only 4 or 5 anti-glaucoma medications. And what happens is that once we exhaust all these medications, that is, we are using 4 or 5 drugs to reduce the eye pressure, and still the eye pressure is borderline, or it's high, or it's not at a level where we can prevent progression of glaucoma because of raised eye pressures, that's when we decide to opt for surgery. Now, that's for open angle glaucoma. With closed angle glaucoma, if with the laser is used to sort of equalize the eye pressure from the narrow angle part. So, if with the laser we are able to control, well and good. If with laser and medication we are able to control, well and good. If not, then of course, again, we'll have to sort of go in for surgery. And there are various other types of glaucomas, like secondary glaucomas, which may be because of other disturbances in the eye. We don't really need to go into that, but those again have their complex course and varied treatments. But the main treatments for glaucoma include the drops, the laser, and the surgery. Now, the surgery is called trabeculectomy, and usually it's done by a ophthalmologist or a glaucoma surgeon. And what it involves is creating a alternate pathway for the water to exit the eye. And what it does is it brings about a decrease in pressure, which is good enough to prevent the progression, or to minimalize the amount of progression that can take place. So trabeculectomy is the main option. Now, again, as the types of glaucoma vary, like the secondary glaucomas and the other complicated conditions which may coexist with other eye conditions like uveitis or corneal issues. So for those, there are other treatments like valves, which is valve surgery for glaucoma. And there are certain minimally invasive treatments, that is eye stent, etc. So these are basically implanted in the eye to sort of again give a better outflow to the water of the eye or the aqueous. Now, other than these, there are certain other laser procedures which may be used, and this is at the discretion of the eye surgeon or the glaucoma surgeon, what treatment is given at what point. Now, after surgery, again, the aim is, of course, to reduce the pressure to the highest extent possible, but it may require medication even after surgery, and that is usually decided based on how severe or how much your glaucoma has progressed before deciding what kind of treatment has to be done after the surgery. Sometimes you may need multiple surgeries as well. Now, when there is a cataract surgery done, that is, you have glaucoma, you have cataract surgery, sometimes just by removing the cataract, the eye pressures can become much more reasonable and easier to manage. Sometimes, along with the cataract surgery, you may require a trabeculectomy. That's the glaucoma surgery. So, this is again something which is left to the surgeon. So the main point is that once all the medications are exhausted, only then we go to the surgical option. Surgery, of course, comes with its own um, uh, sort of risks, but usually what happens is that the surgeon, weighs the risks, sees how much your glaucoma has progressed, and then decides that whether to go in for the surgery or not, or whether there are non-surgical ways in which that can be handled. So that again will be decided at the time of diagnosis and management. So the bottom line is, get yourself screened for glaucoma, because it's important that it's picked up early if it's there at all. If you have family who has glaucoma, even more reason why you should get a glaucoma screening done. Get those tests done. Make sure that you don't have any glaucoma, or if you do, then you're started by the doctor on treatment as per their discretion. And most importantly, regular follow up. So, anyone who has glaucoma already, it's not advisable to visit your doctor, get started on treatment, and then stop the treatment on your own, or visit your doctor, get started on treatment, and be on treatment sort of on your own for 2 years, and you disappear for 2 years and then don't come back. So, these things are not advisable. Uh, your doctor will most likely call you every 3 months or 6 months. If you have glaucoma, they will want to repeat your tests at frequent intervals in order to check how much you're progressing, because they already have your test reports from the baseline. So they'll keep checking at what rate the progression is there, or if it's stable or not, that they'll have to check. So it's important that you keep going back on time for um, your follow up and your treatment. So now what we'll do is, we'll just go ahead and answer a few questions from the audience, which would have cropped up. Yeah, so there is a question. Are there any emerging or experimental treatments for glaucoma that show promise? So I would say the few experimental things are the drugs. As I said, there are only 4 or 5 drugs. So people are continuously researching ways in which they can have more and more newer drugs, so that they can be added in order to prolong the duration of medical treatment, and sort of prevent having to undergo a surgery. So there are drugs which are being researched, and of course treatments. So like I mentioned, the minimally invasive glaucoma surgery, so which involves implanting tiny stents in the eye, that again is undergoing further development, and there are newer and newer stents which keep coming up, and which are sort of better, can be combined with cataract surgeries, etc. So these sort of show some promise. Now we'll see if we have another question. Okay, the next question is, can you explain the importance of regular follow-up and monitoring? So, as I've been stressing that it's important to have a regular follow-up, But the reason why you need this regular follow up is to check the progression. So, what happens is you come the first time, we do certain tests, we start you on certain medication. Now, it's not a hard and fast rule that only those medications will be required for you. We need to see you again in about 3-4 months to see if with that medication your pressure is under control or not, if the control is adequate or not. How do we decide if it's adequate or not? By checking the pressure the next time, by doing the tests the next time. So then we compare. So the damage which is there in the first visit, is it still there in the second visit? Now, the other thing is that the damage which happens once the glaucoma starts and once we detect it with the glaucoma tests, that damage cannot be undone. So, what happens is the damage which is already there, it remains. The aim of the ophthalmologist after this is to prevent further damage. So that's why we have to keep monitoring based on the tests that we have, let's say 20% damage now, 25% damage the next time. So we're trying to reduce the progression and the amount of damage that keeps developing. So that's the reason why monitoring is important. Now, are there any potential side effects or complications associated with glaucoma treatments that patients should be aware of? So, with respect to the eye drops, now each of the eye drops that are prescribed as anti-glaucoma drops or IOP lowering, that is intraocular pressure lowering drops, each of them have certain side effects. Now, everybody may not get side effects, but some subset of people develop small side effects to each of these. So, some side effects could be developing of redness or irritation or watering in the eyes. That's the most common side effect. Or you may develop elongation of the eyelashes. So, a certain subset of drops can cause that, and some of them may develop inflammation in the eye. All these things are kind of visible, and you would probably realize that a certain drop is not suiting you. In that case, your ophthalmologist would change the type of drug. Now, with respect to surgery, of course, there is in severe cases when already the visual field has been constricted quite a bit, surgery can cause loss of vision. So that is something when it's in a severe condition and somebody is going to be operated under high risk by a very skilled glaucoma surgeon. Of course, they are explained before surgery that this is under guarded visual prognosis. Okay, so that means that the person is aware that they are undergoing the surgery to save whatever vision possible, but uh, they could have a negative outcome as well, and that is a part of the risk of surgery. And these things are explained very clearly before surgery is undertaken. So this is what you should be aware of. Now, what are the factors which influence the choice of treatment for an individual with glaucoma? So, number one, of course, the age. That is the type of glaucoma that the person has. So, that would definitely play a big role in the type of treatment that we decide on. The second thing would be uh, the systemic status. That is, whether they have cardiac conditions, whether they have asthma or not. All these things decide what kind of drops we can use and which category of drops we should avoid. So these are some of the factors which influence, and of course, how severe the glaucoma is. So that's the main thing, and the category, that is, if it's open angle or closed angle. So another question that we've got is, how can patients participate in managing their glaucoma and maintaining eye health? So I would say the first and foremost is, of course, coming for the checkups on time, as indicated by the doctor. Like a plus or minus 5 days will not make a big difference, but you should not disappear for months together. The second thing is um, uh, that you sort of follow the schedule of the drops. Now, you may have one or two or three or four or five drops to put, It's of course extremely difficult to follow, a very stringent schedule for this. But if you can sort of be organized and have a rough timetable for when you're going to put your drops, that makes a huge difference in sort of helping the doctor maintain your eye in the condition that they found it in. So it's important that you sort of are very compliant with your drugs, and as far as possible, you don't miss any doses. So that's how you can also participate. And can you share some success stories or examples of patients who have effectively managed their glaucoma with various treatment options? Yes, we of course have several stories, starting from children who are in their teenage, who needed glaucoma surgery at an early age. They of course are lucky because their parents keep ensuring that they return for checkup. So those are one subset of patients. And the other are of course slightly older people who have been trying to manage their glaucoma with their medications, etc., but eventually they do need surgery, sometimes uh, around their cataract surgery also. So these are there are various glaucoma is something which is extremely common for an ophthalmologist to see. So around 20% of our outpatient clinics would have glaucoma patients. So there are most of the patients nowadays understand the importance of follow up, and they are effectively managed. So, what are some misconceptions about glaucoma treatment that you would like to debunk? So, I would say the major myth is that it's associated with BP problems, that is, hypertension or high blood pressure. So, high blood pressure doesn't really have too much to do with glaucoma or the eye pressure. So, that is one thing. And there are no exercises, uh, like people come and ask that what exercise can I do instead of drops to make sure that my glaucoma doesn't progress or that my glaucoma gets treated. So there's no exercise which can, make sure that you don't have to take drops. You have to put the drops the way they are advised. And of course, the third thing would be that there's no way to reverse the damage which glaucoma has already done. So there's no treatment which can sort of make your eye go back to normal, or your optic nerve go back to its original state. So this, it's important that you accept this, and that you sort of stick to the treatments so that whatever vision you have left, that can be maintained taking forward. So I would say thank you everyone for listening, because this is an extremely important and universal topic that everybody discusses. And the final message would be to visit your ophthalmologist, get a screening done, make sure you don't have glaucoma, and get the screening of your relatives done as well, especially the elderly, so that if at all there are any signs of glaucoma, we can start treatment early, because it is definitely a preventable cause for blindness. Thank you.